Okay. Good morning to all. Today my topic is anti-inflammatory drugs. So in that, first of all, these are also called as NSAIDs. NSAIDs means non-steroidal anti-inflammatory drugs. The non-steroidal anti-inflammatory drugs are widely used for the treatment of minor pain and for the management of edema and tissue damage resulting from inflammatory joint disease. Is nothing but arthritis. A number of these drugs possess antipyretic activity in addition to having analgesic and anti-inflammatory action. Analgesic means these are the drugs which are used to reduce the pain. Anti-inflammatory means these are the drugs which are used to reduce the inflammation. So that's why we are called anti-inflammatory drugs and thus have utility in the treatment of fever. These are the drugs which are used to reduce the elevated body temperature. So that's why we are called these are the antipyretics. Some of the primary indications for NSAID therapy include rheumatoid arthritis, osteoarthritis, acute gouty arthritis, ankylosing spondylitis. Next, coming to the next one. So in that there are first of all, COX enzyme. COX means cyclooxygenase enzyme. There are two COX isoenzymes have been identified. These are COX1 and COX2. COX1 means cyclooxygenase 1 and COX2 means cyclooxygenase 2. In that COX1 constitute enzyme is present in a wide variety of cell types and influences the housekeeping functions of prostaglandins. This activity is particularly important in the gastrointestinal tract, the kidneys, and the circulatory system. Next, coming to the COX2. COX2 means is nothing but cyclooxygenase 2 is inducible enzyme. It is found only in a few cell types, especially macrophages and other leukocytes, fibroblasts, and endothelial cells, including those of the vascular system. Next, COX2 involved in those aspects of the inflammatory process that are mediated by prostaglandins. Next, coming to the next one, and any inflammatory stimulus activates COX2 inducible enzyme which synthesizes PGI2. PG means prostaglandin I2, PGE2 means prostaglandin E2 in macrophages, leukocytes, fibroblasts, endothelial cells, which causes inflammation. Cyclooxygenases is nothing but prostaglandin synthetase, the enzymes that catalyze the synthesis of cyclic endoperoxides from arachidonic acids to form prostaglandins. Next, the major mechanism by which the NSAIDs elicit the therapeutic effects in that antipyretics, analgesics, anti-inflammatory activities is inhibition of prostaglandin synthesis. Specifically, NSAIDs competitively inhibits the cyclooxygenases are also called prostaglandin synthetase. Generally, the NSAIDs inhibits the both COX1 and COX2. Most NSAIDs are mainly inhibit COX1 selective. Example, aspirin, ketoprofen, indomethacin, piroxicam. Next, others are considered slightly selective for COX1. Example, ibuprofen, naproxen, diclofenac. And others may be considered slightly selective for COX2. Examples are meloxicam. The mechanism of action of celecoxib and rofecoxib is primarily selective inhibition of COX2 at therapeutic concentrations. The COX1 isoenzyme is not inhibited, thus GI toxicity is decreased. Next, classification of anti-inflammatory drugs. Under that, first one is salicylate. Under that salicylates, examples are aspirin, sodium salicylate. So these two are the examples for salicylates. Second one is propionic acid derivatives. These are also called as profens. Under that, one of the example is ibuprofen. Next, aryl acetic acid derivatives. Example is diclofenac. Next, indole acid derivatives. Examples are indomethacin and one more drug is salindac. Next, anthranilate. anthracylates. These are also called as phenamates. Example is mefenamic acid. Next, coming to the oxycams, enol acids. Under that, one of the example is pyroxycam. Next, phenylpyrazolone derivatives. Example is phenylbutazone. Next, enolide derivatives. Example is paracetamol. Next one is pyrrolo derivatives. Example is ketorolac. So in that classification, preferential COX-2 inhibitors are also there. So under that COX-2 inhibitors, examples are celecoxib and rofecoxib. First of all, we'll discuss about the salicylates. The salicylates are they were discovered in 1838 following extraction of salicylic acid from willow bark. Salicylic acid widely used medicinally as the sodium salt but replaced therapeutically in the late 1800s by acetyl salicylic acid is nothing but aspirin. So coming to the mechanism of action. So the salicylates have potent anti-inflammatory activity with mild analgesic and antipyretic activities. These compounds are mainly COX-1 selective. They are bound with a higher affinity to COX-1. The therapeutic and some of the toxic actions of aspirins can be related to its ability to inhibit COX-1 in various tissues and participates in trans-acetylation reactions in vitro. Examples are sodium salicylate, acetyl salicylic acid is nothing but aspirin, and next one is phenyl salicylate. Next, coming to the sodium salicylate. Sodium salicylate is an benzene carboxylate derivative. It occurs a white crystalline powder or small colorless crystals or shiny flakes. These are freely soluble in water, sparingly soluble in alcohol, and practically insoluble in ether. Sodium salicylate is employed for the relief of pain, rheumatic fever, and symptomatic treatment of gout. So this is the structure of sodium salicylate. Generally, first of all, what is the structure of salicylic acid means benzene ring attached with OH along with COOH. Actually, that is the structure of salicylic acid. 2-hydroxy. 2-hydroxybenzoic acid is nothing but salicylic acid. 1H replaced by sodium. So that's why we have to get the sodium salicylate. So this is the structure of sodium salicylate. Next, coming to the next one, acetyl salicylic acid. Next one is acetyl salicylic acid. So is nothing but this one is also called as aspirin. So it occurs in powder form. It is slightly soluble in water and soluble in alcohol, chloroform, ether, and glycerin. Next, aspirin is stable in dry air, but in presence of moisture, it hydrolyzes slowly into salicylic acid and acetic acid. Aspirin is acidic and produces efflorescence with carbonates and bicarbonates. So, this is the structure of acetyl salicylic acid. Is nothing but aspirin. So already you know that salicylic acid structure benzene ring attached with COOH along with the OH, but one H replaced by acetyl group is nothing but COCH3 group. So that's why we have to get the acetyl salicylic acid. So this is the structure of acetyl salicylic acid is nothing but aspirin. So next coming to the use, aspirin is used as an antipyretic, analgesic and anti-rheumatic. Next coming to the phenyl salicylate. So under that phenyl salicylate is available in white crystalline powder. So phenyl salicylate means already you know that. So salicylic acid means benzene ring attached with OH along with COOH. One H replaced by phenyl ring. This one. So that's why we are called this is the structure of phenyl salicylate. So it is available as white crystalline powder with aromatic odor. It is insoluble in water but freely soluble in alcohol, ether, chloroform, acetone, and fixed oil. Next, coming to the propionic acid derivatives, examples is nothing but these are also called as profens. So in that general structure, AR in this structure contains CHAR along with CH3 COOH. AR means is nothing but aryl or phenyl ring. These compounds are referred to as profens. Propionic acid derivatives is nothing but profens. We are also called as, based on the suffix of these prototype number ibuprofen. These agents are strong organic acids. pKa is nothing but 3.0 to 5.0 and thus form water-soluble salts with alkaline reagents. All these compounds are predominantly ionized at physiological pH and more lipophilic than acetyl salicylic acid or salicylic acids. The alpha CH3 substituent present in the profens increases the cyclooxygenase inhibitory activity and reduces toxicity of the profens. The alpha carbon in these compounds is chiral and the S enantiomer of the profens is the more potent cyclooxygenase inhibitor. Next, coming to the mechanism of action, generally the profens are considered to be slightly COX-1 selective. COX-1 means already you know that cyclooxygenase 1. They are used for rheumatoid arthritis, osteoarthritis, and as analgesics and antipyretics. Next, coming to the example, ibuprofen. So in that ibuprofen structure, C6H5 is nothing but phenyl ring attached with methyl along with the acid is nothing but carboxylic acid. But in this CH2 attached with CH3 twice. That is the side chain present in the structure of ibuprofen. Next, coming to the next one is aryl acetic acid derivatives under that. Example is diclofenac. IUPAC name is 2,2,2,6. Dichloroanilino-phenyl acetic acid is diclofenac, which is an example for aryl acetic acid derivative. So already you know that aniline structure. Aniline means benzene ring attached with NH2. Again, this one is attached with dichlorophenyl. In this diclofenac structure, compulsory we have dichlorine. Dichloro group along with the C6H5 is nothing but phenyl ring. This one is connected with aniline. Again, this one is connected with the acetic acid is nothing but CH2COOH. Okay, so this is the structure of aryl acetic acid derivatives. Under that, one of the important drug is diclofenac. Next, coming to the indole acetic acid derivatives. Under that, in that indole acetic acid derivatives, first one is indomethacin and second drug is salindac. Okay, so chemically indomethacin is 1 parafluorobenzoyl 5-methoxy 2-methyl indole 3 acetic acid. So indomethacin is COX-1 selective and produces primarily anti-inflammatory actions with some analgesic and antipyretic activity. It is used for rheumatoid arthritis, osteoarthritis, ankylosing spondylitis, to suppress uterine contraction and to promote closure of parent ductus arteriosus in neonates. Is nothing but this is another one is nothing but neonates means is nothing but premature infants. Next, coming to the salindac. In these agents, the indole nitrogen has been eliminated, which makes the drug resemblance to 5-HT. 5-HT means 5-hydroxytryptamine, and therefore fewer CNS side effects are seen. This compound has pharmacological actions similar to indomethacin. Is nothing but COX-1 selective and anti-inflammatory primarily. It is used for rheumatoid arthritis, osteoarthritis, acute gout, and to inhibit uterine contraction. So, but in case of indomethacin structure, indole is the basic nucleus. Indole means benzene ring fused with pyrrole. So, this is the structure of indole. Pyrrole means 5-membered ring system along with nitrogen heteroatom is present. So, this is the structure of indole. Again, this one is connected with side chain. This is an MEO. MEO means Me means methyl along with oxygen is present. So that's why we are called methoxy group is present in that structure. Again, this one is connected with CH2COOH is nothing but acetic acid. Again, nitrogen attached with chlorophenyl along with carbonyl group. So finally, this is the structure of indomethacin. In the structure of indomethacin, indole is the basic nucleus. But in case of salindac structure, indole is absent, indene is present. Indene means due to the absence of heteroatom in that structure of salinidate. So this is the structure of indene. Benzene fused with the 5-membered ring system due to lack of heteroatom, that is nitrogen. This one is connected with fluorine, again attached with the double bond along with the phenyl sulfone. Next, this one is connected with acetic acid. So this is the structure of salinidine. So indole is present. Indole is the basic nucleus present in the structure of indomethacin. Indene is the basic nucleus present in the structure of salinidine. Next, coming to the anthranylates. Anthranylates are the N-aryl anthranylic acid or N-anthranylic acid derivatives, which is a bioisoester of salicylic acid. These agents retain the acidic properties that are characteristics of this class of agents. The most active phenomates have small alkyl or halogen substituents at 2-3- and are 6th position of the N-aryl moiety. Is nothing but meclophenamate is 25 times more potent than mefenamate. Among the disubstituted aryl phenomates, the 2-3- derivatives are most active, suggesting that the substituents at the 2-3- position serve to force the N-aryl ring out of coplanarity with the aryl anthranylic acid. Hence, this steric effect is proposed to be important in the effective interaction of the phenomates at their inhibitory site on cyclooxygenase. Next, coming to the mechanism of action of anthranylates have primarily anti-inflammatory with some as mild analgesic effect. Example is mefenamic acid. Mefenamic acid, this is a very important drug. So in that mefenamic acid structure, aniline. This is the structure of aniline. Aniline means already you know that benzene ring attached with NH2. Again, this one is connected with carboxylic acid. This one, again, this one is attached with dimethyl phenyl. This is the structure of mefenamic acid. Next, coming to the oxycams, under that one of the important drug is pyroxycam. Pyroxycam and meloxicam are characterized by the 4-hydroxybenzothiazine heterocycle. The acidity of the oxycams is attributed to the 4-hydroxy with the enolate anion being stabilized by intramolecular hydrogen bonding to the amide NH group. These compounds are acidic pKa is equal to 6.3. That is the pKa value for these oxycams. Next, coming to the mechanism of action. These are the selective COX-2 inhibitors. These agents used in the treatment of rheumatoid arthritis and osteoarthritis. Next, coming to the oxycams. Under that, one of the example is pyroxycam. So this is the structure of pyroxycam. This is an pyridine ring. This one is connected with side chain NH along with the C double bond O. So that's why we are called, this is an amide group or C double bond O NH2. That is the general structure for amide. Again, this one is connected with benzene along with thiazine. Thiazine means thia means sulfur along with thiazine means nitrogen. Actually, in this structure, sulfone group is present. Sulfone means is nothing but H double bond O group is present. At para position, hydroxy group is present. So finally, this is the structure of pyroxycam. Next, coming to the next one is phenyl butazone. So these are the agents which are characterized by one aryl 3,5 pyrazolidine dione structure. The presence of a proton which is situated alpha to 2 electron withdrawing carbonyl groups renders these compounds acidic. The pKa for phenyl butazone is 4.5. Oxyphen-butazone is a hydroxylated metabolite of phenyl butazone. Example is phenyl butazone. So, butazone means already you know that it is a 5-membered ring system along with the 2 nitrogens, 2 C double bond O groups present in this structure. Again, this nitrogen attached with the phenyl ring. This one is connected with phenyl ring. Again, this is the side chain. It's nothing but CH2, CH2, CH3. CH2, CH2, CH2 along with CH3. Bute means totally we are having 4 carbons. Okay. This is the structure of butyl. Along with azone. Azone means due to the presence of 2 nitrogens along with 2 C double bond O groups. Diphenyl means due to the presence of 2 C6H5 groups. So this is the structure of phenyl butazone. Next, the enilides are simplest estimates of enolate, which may or may not contain a 4-hydroxy or 4-alkoxy groups. Enilides do not possess the carboxylic acid functionality and therefore they are classified as neutral drugs and possess title inhibitory activity against cyclooxygenase. Examples are acetaminophen or paracetamol. So this is the structure of paracetamol or acetaminophen. Acetaminophen, that is the another name for paracetamol. So in that structure, we have amide functional group C double bond O and H2. This one is connected with phenol. Phenol means benzene attached with OH. Okay. Again, this one is connected with acetamide. Acetamide means CH3CO and H2. So this is the structure of acetamide. Okay. Along with phenol. So this is the structure of paracetamol. Next, coming to the ketorolac, is a potent analgesic and modest anti-inflammatory active drug. It inhibits prostaglandin synthesis. Ketorolac is frequently used in post-operative dental and acute musculoskeletal pain. So this is the structure of ketorolac. This is a very important drug in this ketorolac. So this one contains benzene attached with C double bond O group. Again, this one is connected with pyrrole and this is an pyrrolidine. Pyrrolidine means it is an pi membered ring along with nitrogen heteroatom is present due to lack of pi bonds in that structure. Okay. Again, this one is connected with carboxylic acid is nothing but COOH group. Okay. So finally, this is the structure of ketorolac. Next, coming to this is an briefly about NSAIDs. NSAIDs are the planar structures. These are having analytics also and contains a NSAIDs are characterized by the following chemical and pharmacological properties. All are relatively strong organic acids with pKa in the 3 to 5 range. Most but not all are carboxylic acids. Thus, salt forms can be generated upon treatment with base, and all of these compounds are extensively ionized at physiological pH. The HD group is essential for COX inhibitory activity. The NSAIDs differ in their lipophilicities based on the lipophilic character of their aryl groups. Aryl means is nothing but C6H5 groups and additional lipophilic moieties and substituents. The acidic group in these compounds serves as a major binding group, is nothing but ionic binding with the plasma proteins. Thus, all NSAIDs are highly bound by plasma proteins, is nothing but drug interactions. The acidic groups also serves as a major site of metabolism by conjugation. Thus, a major pathway of clearance for many NSAIDs is glucuronidation and inactivation followed by renal elimination. And finally, thank you.